Hello everyone, on behalf of Moja Ramesh Amity's Health Tourism Company, once again I'm here with you to talk about surrogacy in Iran, especially for foreign applicants. We talked about the basics of this procedure in the last video, and today I'm going to be more specific about the process in Iran. So, one thing to consider first is that the intended parents and the surrogate mother, before coming to Iran, need to have devised and drafted the legal gestational surrogacy contract in the country of their residence, and then have it verified at the Iranian consulate of their country. Or they can do the verification when coming to Iran in one of the affiliates of the Iranian Ministry of Foreign Affairs. One thing to consider is that surrogacy here is only possible if the surrogate mother is not Iranian. So the intended parents need to have chosen their surrogate of another nationality except Iran. So when they come to Iran, the IVF treatment begins from the first medical consultations, and the first step is that both parents, the intended mother and the intended father, and the surrogate will go through some medical assessments. For example, the intended mother will go through tests for assessing their ovarian reserves, that is to say the quality of their eggs, and the intended father for the quality of their sperm. And the IVF, as I explained to you, in vitro fertilization, which is fertilization of the egg by the sperm in the lab out of the body, the treatment begins after these assessments, and it is on the first day of the ovulation cycle of the intended mother. In the process, the intended mother and the surrogate's cycle need to be synced, and the first step is that the intended mother will go through some hormonal stimulation of their ovaries, that is to stimulate the ovaries to produce more than one egg, which is the natural process, because for the IVF there needs to be multiple eggs. That is why the intended mother will go through some hormonal medication to stimulate egg production. The next step is the retrieval of the eggs from the intended mother and the sperms from the intended father. And the third step is the fertilization of the egg by the sperm in the lab, which is the main process that is called insemination. The cultivation, the embryo culture usually takes about 3 to 5 days, and after the embryo is successfully cultivated, it will be tested for genetic disorders, which will require extra genetic tests before implantation. The next step, which is the fourth one, is the transfer of the cultivated embryos to the uterus of the surrogate mother, and about 6 to 10 days after, a pregnancy test, usually a blood test, will be taken to see if the pregnancy is positive. Now, this process usually takes about 2 to 4 weeks, and if the cycle, if the IVF is not successful and it's failed, it needs to be repeated. In that case, if in the prior steps the extra embryos have been frozen, they can be used, or the process can be repeated from day one. Now, and after the test is positive, that means that the IVF is successful, and the surrogate mother will carry the fetus and the baby to term for 9 months. Now, who are good candidates for surrogacy and especially IVF process? Usually intended parents who are struggling with infertility or other medical problems, such as the malfunction of the ovaries of the mother and reduced fertility in women over 40 years old, or it can be due to recurrent miscarriages in the past, or any general reason that the mother cannot carry the child in her womb, or any unexplained infertility. This is true for the intended father too. The quality of their sperm, the sperm count, or abnormalities of the sperm, these are the reasons that usually to-be parents will go for surrogacy. Another reason is that intended parents may not want to pass on genetic disorders to their offspring, so surrogacy is the next viable option for them. And another reason, there are other different medical reasons for choosing surrogacy that is related to the woman that struggles with cases like endometriosis or blocked or damaged fallopian tubes, etc., etc. And that is usually and in this case surrogacy can be the next best option, because especially gestational surrogacy, which means that the born baby is genetically related to the intended parents and it has nothing to do with the surrogate mother genetically. So, and in this case, as I explained before, the legal agreement between the surrogate mother and the intended parents is of paramount importance, and it is the first most important step to be taken to choose the proper and the appropriate surrogate mother for the process. In Iran, the surrogacy process, which is taking care of the medical part, the cost of it ranges from $8,000 to $12,000 depending on different factors. If advanced diagnostic tests need to be taken, such as genetic screening, or if the cycle needs to be repeated for the second or the third time. That is why the cost usually has a range. So I think that is all that you need to know as the prospective parents to consider before choosing Iran for this process. And if you have any other questions regarding surrogacy, the costs, terms of accommodation, visa, etc., etc., or any medical questions, please contact us through our social media, be it Instagram, WhatsApp, our website, amitismetsur.com, and we will get back to you with the best consultations possible at the soonest time. Thank you for being with me, and hope to see you again for our future presentation of medical services of our company in Iran for foreign applicants. Thank you and have a good day. Bye.